Morning, everybody. Please come in. I know we've got another full day and we've got a full panel, so I think we'll make a start. I'd like to begin first by acknowledging the traditional custodians of the land that we're meeting on today, the Ngunnawal and Ngambri people. I'd like to pay respect to elders past and present and recognize their continuing connection to country. I'm always really heartened when I come back from trips overseas and I come back to Canberra and I see how beautiful it is here, and thinking about for how many generations this land has been cared for, and really how fortunate we are to live in such a beautiful place. My name is Camilla Burkot. I'm Senior Technical Advisor with DFAT's Global Health Division. It's a real pleasure to be here today to chair this panel on evaluation related to public health, water, sanitation and hygiene, and sexual and reproductive health and rights. I think we can all agree that these three thematic areas are incredibly relevant to development in Australia's near region and indeed around the world. They're not just technical domains, they're really critical in terms of realizing inclusion and equity and as sort of foundations for broader sustainable development. But we know that the progress is very uneven across our region, with access to safe water and sanitation being a real challenge, particularly for people in rural communities, the urban poor. Too many women and girls still facing barriers to realizing their rights and accessing essential services. And of course, we're all very familiar with having experienced the COVID pandemic, but also new emerging diseases, new epidemics every day. Public health remains a major challenge. And of course, evaluation plays a really important role in this. Done well, we know that evaluations shouldn't just be about measuring outputs. It shouldn't just be about ticking a box for compliance for donors, even though I think I can say as somebody who sits in DFAT, we have a lot of compliance requirements, but we really should be using evaluations to think about what impact are we having? Are we reaching those most in need? Are we actually achieving those goals of equity and inclusion? Are our interventions socially appropriate, culturally appropriate? And are we learning fast enough to keep up with all of the changes that are happening in the world? So it's not an easy task. We know there's a lot of evaluations that get done and unfortunately don't get really interrogated and looked at closely enough, but I'm really excited today that we do have an opportunity to look closely at a few evaluations, to think about how we can use evaluation more effectively in these areas, to not only to improve the programs, to disseminate them more widely, but also as a tool, as I said, for strengthening inclusion and equity and improving accountability and learning. So lots of rich discussion to come. Thank you all for being here. First thing early in the morning. Quick housekeeping for how we'll run the session. So we have 3 speakers, 2 here in person and 1 online. Each speaker will speak for up to 20 minutes, one after another. We'll give you a wave. Please come in. We'll give each speaker a wave at 15 minutes so you know how much time is left. And then please hold all your questions until the end. I want to make sure that every speaker has enough time to get through their presentation before we turn to questions. But please, if you have a question, make a note, and then we'll have some roving mics and we'll have, I think, a really good discussion. So with that, I would like to introduce our first speaker, who is Ms. Sarah Adams. Sarah is a program coordinator in the international programs team at UNICEF Australia. She has worked at UNICEF Australia for over 6 years and currently manages a portfolio of projects focused on child, adolescent, and maternal health and early childhood development. Projects that Sarah oversees are mainly implemented in the East Asia and Pacific region, including Papua New Guinea, Timor-Leste, Cambodia, and the Pacific Islands. And Sarah is currently studying a Master of Public Health at the University of New South Wales. So Sarah, over to you.
Is this working? Yes. Okay. Hello, everyone. Good morning. And yes, thank you for joining us on this very early morning in Canberra. And thank you, Camilla, for that very warm introduction as well. So my name is Sarah Adams, and I am from UNICEF Australia. And today I'll be speaking about the UNICEF-supported OCI app and the results assessment that was conducted in March 2024. But I thought I would just start off today with just sharing a bit about the context and why OCI is important. So more than 1.8 billion women and girls menstruate worldwide, and despite its natural and monthly occurrence, millions of adolescent girls across the Southeast Asia and Pacific region continue to face stigma, misinformation, and limited access to affordable period products. Shame often prevents open discussions about menstruation and sexual health and reproductive rights in schools, communities, and families. Many adolescent girls are unprepared for their first periods, experience severe distress and confusion. The guidance that they do receive on sexual health and reproductive rights is often full of myths and inaccuracies, reinforcing harmful gender norms and unsafe practices. These barriers keep girls out of school, women away from work, and perpetuate cycles of poverty and exclusion. Menstrual health and hygiene is a fundamental issue of dignity, health, and gender equality. Next slide, please. So, what is OCI? OCI is the first open source digital menstruation and sexual and reproductive health education app for girls. It is co-created by and for girls in low and in middle income countries as part of a multi-platform product series. It is an approved digital public good, and it is tailored to girls' needs and realities. So it works offline, it works with low-end phones and with low connectivity. It is easy to use, so it supports girls with low digital literacy levels. It is data light and has a high data protection and privacy by design. So there's no personal identifiable information stored or collected, and all of the data is stored on the device, and it's not for commercial use. And it can also support multiple logins. So if there's only one phone in the household, then multiple girls and women can use the app. The app provides period cycle tracking, and it contains evidence-based information on sexual and reproductive health rights. It has an encyclopedia which contains all of the information, and it is gamified, so it's fun for the girls to use. It has games and quizzes embedded as a way to educate. The app is localised and managed by a franchise partner in each country. There are currently 13 countries that have deployed and localised OCI, and next year there will be an additional 3 countries. And it is promoted mainly through schools and through community outreach. Next slide, thank you. So in 2024, in March, UNICEF commissioned BBC Media Action to conduct a results assessment of OCI and its impact for adolescent girls in Indonesia, the Philippines, and Papua New Guinea. The results assessment focused on 4 key intended outcomes, that is gaining knowledge, changing perceptions, links to services, and sharing. Next slide. The methodology was designed by BBC Media Action in consultation with Bath Social and Development Research and UNICEF research team. It used an adapted version of the QUIP methodology, which is a qualitative impact assessment that tests assumption and pathways in a theory of change by collecting narrative accounts from beneficiaries about what caused changes in specific areas and why. So it asked adolescent girls to openly and honestly share any changes they experienced across OCI's outcome areas. The girls were fully blindfolded, however the researchers weren't, and that's because they needed to gain access to OCI users through schools and key partners. And then towards the end of the interviews, the researchers unblinded the girls, and then they asked specific questions about OCI, and those results were separated from the report so as not to mix the data. And the researchers conducted a desk review research. They held qualitative interviews in each location. There were focus group discussions and stakeholder consultations. And the researchers also observed OCI events to understand OCI's engagement and attraction among girls. In each location, the research trained young female researchers to interview the adolescent girls. And the locations were they were chosen based off the high number of users in each location, as well as whether there had been any promotion of OCI in the preceding year. And if there were any anomalies that the research team were particularly interested in exploring. Next slide. Okay, so this is just an overview of the key findings, and then I will dig a bit deeper into the 4 intended outcomes. But as the high-level results, so the results assessment found that OCI is an accepted digital use case for adolescent girls, with causal evidence supporting 3 of OCI's 4 intended outcomes, and that particularly shown through for the building knowledge and changing perceptions. Adolescent girls attributed their increased confidence, comfort, and openness around managing their periods and understanding their bodily changes to knowledge gained through OCI. And teachers and health workers supported these findings. They observed that OCI influenced behaviour change among adolescent girls, particularly menstrual hygiene. Okay, next slide. Okay, so just to go further into the first intended outcome, which was gaining knowledge. So the research found that OCI is a trusted, credible source of information for adolescent girls. In the Philippines, over 3/4 of girls and nearly half in Indonesia identified OCI as a key source of information for periods and puberty. The app helps to track their menstrual cycle, prepare for their periods, debunk myths and misconceptions about menstruation. Girls reported learning about hygiene practices, recognising symptoms and understanding puberty as a normal part of growing up. And teachers and health workers confirmed the effectiveness of OCI for education and period tracking. OCI is especially appealing for the younger adolescents. So in the Philippines, the age group was between 10 and 13, and Indonesia up to 15. But for the older girls, so that 17 to 19 age group, it was found that the content was less relevant or less engaging for the older girls. So there will be a need for more tailored content for the older girls. And just to share a quote, so this is from a 12-year-old OCI user in the Philippines. The OCI app is the most trustworthy source of information. It has all the answers to your questions about menstruation. It also tracks when your next period will be or when your last period was. And there's also a fun aspect to it, making it feel like a game. Next slide. So the second intended outcome was changing perceptions. So it was found that OCI boosts confidence and normalised menstruation. Girls reported feeling more open, comfortable and confident about managing their periods. In Indonesia, OCI helped girls feel more prepared and less embarrassed, breaking taboos around puberty and menstruation. In the Philippines, nearly 2/3 of girls said OCI positively influenced their attitudes, helping them feel less shy or embarrassed. And in Papua New Guinea, OCI is really empowering, especially in an environment where menstruation is taboo. Girls felt more confident and autonomous and prepared for their period, and they were really open to sharing this with their friends, especially. Engaging boys and male influences has shown some positive impacts in breaking taboos. In Papua New Guinea, the franchise partner is piloting a radio show where there are male hosts of the radio show, and that is to support girls who don't have access to a phone. So it is sharing those key messages about menstruation and periods and sexual reproductive health rights. And through the school sessions when they're promoting OCI, there was also male teachers that were involved in that promotion as well. So there has started to be some male influence in OCI, which is really important. And next slide. So for the sharing outcome, so OCI sparks discussion among peers, families, and in schools. In the Philippines, 83% of girls recommended OCI to their friends or relatives. The app facilitates peer and family conversations, complements and sometimes corrects other information, and helps tackle menstrual myths. There is promising evidence that OCI is promoting discussion in safe spaces, so that includes the home and among peers. And there is less evidence of OCI being promoted in the wider community. But as I mentioned, the Papua New Guinean radio outreach is trying to expand that into the broader community. And next slide, thank you. And finally, the fourth intended outcome was the links to services. This was the outcome with the least amount of evidence. Some girls reported increased awareness of services, and a few accessed counselling via OCI. Excuse me. Stakeholders suggest that OCI increased awareness of available services, but more research is needed to understand barriers to service access. There is a find help feature in OCI which signposts to services, but uptake of that is still quite low. However, in Papua New Guinea, stakeholders believe that OCI makes girls feel more aware of existing services, even if they have not yet acted on that knowledge. Okay, next slide. Thank you. And I'll just touch on the learnings from the results assessment. So as expected, there are many persistent barriers that remain for menstrual health and sexual and reproductive rights. And OCI's involvement in that as well. So there is limited phone and internet access, especially among low-income and rural girls, which restricts OCI's reach. There are offline and low-tech options available, such as the Papua New Guinea radio programming, and there is also through OCI in Papua New Guinea, it's called Oki Toki Hotline. So if girls have access just to, it does need to be a smartphone, but they can call the hotline and they can receive those key messages by voice as well. And that was just started last year, and it will be interesting to see if other countries take up that as well. Menstruation and sexual reproductive topics remain a taboo in many communities, and that's required more tailored content, and particularly more engagement from parents, caregivers, and community leaders. OCI's accessibility features, so it has the haptic touch and the voiceover, are valued, and there is also there's a gender and disability toolkit that was developed by UNICEF and disseminated through the OCI partners. But the accessibility features, could be some issues with the technical side of that, and then so usability of those, there are many challenges. Where OCI has been most successful is when it's been promoted in schools, and so the full integration into education and health system is ongoing. but there still remains challenges with integrating into school curricula. However, in Indonesia, the Ministry of Religious Affairs promoted Oki's use in Islamic schools through the Healthy Islamic School initiative, which is really promising and exciting. And in the Philippines, the Oki was officially endorsed by the Department of Health and the Department of Education and rolled out in both mainstream and alternative education systems. And that's with ongoing support from regional authorities. And I'll just skip on. So the recommendations yes, thank you. For the future is to really expand the content of Oki, co-create it with the older girls so that it is more relevant and engaging, integrate more social and behaviour change communication content, and building learning from other Oki projects to enhance digital literacy for adolescent girls. The Oki app does include, it includes modules on nutrition and protection and protection from violence. So there is a whole suite of education materials on that app, but it's really how to scale that and make that more engaging. The users' awareness of the services and access to the services, I think there needs to be more investigation into why there are barriers into accessing those services, and also promoting the involvement of boys and male influencers through Oki, and about discussions about the importance of sexual and reproductive health rights, to really foster that enabling environment and community support. It was also found that it's important to engage parents and caregivers as a secondary audience to normalising menstrual health. Mothers and big sisters were seen as a key reference for younger adolescent girls. Usually the first conversation is with the mother, and then they share that information. So it's really how we support those mothers and big sisters, and how to break down those social norms. And the integration into school curricula, I think that is a really important piece. And the UNICEF team and the franchise partners are still looking into how to integrate that further into the school system. The next steps are just the recommendations in action. So I won't go through them, and we might be at time as well. So thank you very much for listening, and I'm happy to take any questions afterwards. Thank you.
Yeah, okay, thank you. Thanks a lot, Sarah. That was excellent. And yeah, I think there'll be a lot of questions and more things to explore when we get to the Q&A. Next up, we have Ms. Miriel Boas joining us online. Miriel, I'll check you can hear me, and hopefully we can hear you.
Hi, Miriel. Can you unmute for me? Thank you.
Hi, Camilla. Good
Morning,
everyone.
Drew.
Yes, I can hear you.
So Miriel is the national coordinator of the One Health Frontline FET PNG program with the University of Newcastle Field Epidemiology and Action Program and the PNG National Department of Health. Miriel has specialized expertise in environmental health, project management, and experience in training in disease surveillance, outbreak investigation, communication, and community engagement. She's a graduate of the Divine Word University of Papua New Guinea with a bachelor's degree in environmental health, as well as a graduate of the One Health Frontline FET PNG program, as well as the intermediate FET PNG program. So Miriel, I will hand over to you. Thank you.
Thanks, Camilla, for the wonderful introduction. And good morning, everyone. So my presentation for this morning will be on the evaluation of the One Health Frontline Field Epidemiology Training Program that was piloted in Papua New Guinea in 2022 to 2023. Next, please. So just to give a bit of a background, Papua New Guinea has a total population of 10 million with 22 provinces and about 100 districts. As a pertaining from the COVID-19 pandemic, there was a critical need for a multi-sectoral approach to public health emergencies. And therefore, Papua New Guinea piloted the One Health Frontline field epidemiology training program in 4 provinces. These provinces are West New Britain, West Sepik, Morobe, and DNCD. All throughout the training, the pilot of the training program, officers from the animal, environment, and human health sectors, particularly at the district and provincial levels, have been included. And so this evaluation was carried out to assess the program's effectiveness and early impact. Next, please. So this training program runs for a period of 3 months, which is 12 weeks, and it has 3 face-to-face classroom intervals and 2 field intervals. In the first workshop, the fellows or the trainees are taught basic epidemiological surveillance concepts where they collect information, collate them, analyze and interpret them, then produce a report afterwards. They also map out basic surveillance systems from the animal, environment, and the human health. In the second workshop, they go out to do a joint investigation and then they produce a report. When they return for workshop number 3, they're basically being taught about communication and community engagement. Next, please. So this study collected both qualitative and quantitative data. However, it was analyzed separately. And so it was focused on 7 key evaluation questions. Number 1, the program's output, the graduates' knowledge and skills, barriers and enablers of translating knowledge and skills into practice, contributions to health system improvements, impact on community health, contribution to sustainability of the training program in country, and unintended positive and negative consequences. Next, please. So this study covered a desktop review, an online survey, which was sent out to all the graduates, and interviews. With regards to the interviews, we had to travel from NCD out to the provinces, the 4 pilot provinces, to interview the graduates and then their line managers. So ethical approval was sought from the University of Newcastle, including the Papua New Guinea Medical Research Advisory Council. Next, please. Results concerning training output, which covers the key evaluation question number 1. So a total of 80% of the graduates have 80% have graduated from this training program, of which 46% came from the human health, 28 from the environmental health, and the rest from the animal health. Next, please. The training outputs revealed that 61 surveillance data review were from human infectious diseases, environment and plant health, animal health, and customs or fisheries. Under field investigations, 61 reports have been produced, and they reported a wide variety of topics, including malaria, diarrhea in cattle and pigs, suspected ASF, cocoa pod borer disease, and to name many more, including food safety issues and climate change issues. Next, please. The graduate survey revealed 67% response rate, and in the interviews, 24 graduates were involved, 9 line managers and 3 senior executive managers. Next. Moving on to results, knowledge, skills, and confidence. So 73% of the graduates reported that they are confident in conducting a descriptive data analysis, investigating One Health alerts, and producing evidence-based recommendations. And as stated by an environmental health officer, from the training, I know I would be able to identify or differentiate between an outbreak or not, and would be able to write up a surveillance report if need be. Next, please. Moving on to relevance of skills and knowledge. So 80 to 90% of the graduates have stated that they found the relevance of the knowledge and skills that are taught to them to be highly relevant and somewhat relevant. None of the graduates stated that it was not relevant. Next, please. Moving on to results application of skills and knowledge. 68% reported that report writing was something of high importance to them, or it was highly applicable. Communicating of findings, especially when they go out to the field to investigate about any disease and communicate findings, data analysis, and participation in outbreak investigations. However, there are some barriers that were faced, and that was due to remoteness and inaccessibility of health facilities and the underutilization of the graduates by their management. Next, please. Moving on to health system strengthening. Improved data collection, data analysis, interpretation, and reporting at the workplace reported the highest, including improved data management, while the lowest reported participating in outbreak or field investigation. So this has significantly contributed to health system strengthening at the provincial level as well as at the national level. Next, please. Cross-sectoral collaboration, 100% of the graduates have reported having access to a provincial WhatsApp group. So the provincial WhatsApp groups have been created for the purpose of coordination and ease of communication between the National Department of Health and the pilot provinces of the One Health Frontline Field Epidemiology Training Program. However, while communicating using these WhatsApp groups, alerts of One Health issues have also been posted in the WhatsApp groups, and it has facilitated most of the responses that were carried out, and they are multi-sectoral responses. Therefore, 71% of the graduates have reported they use these WhatsApp groups to seek technical advice from the different sectors, especially when it comes to addressing One Health issues from the different provinces. Next, please. Contribution to sustainability. So in terms of facilitating the training program, 100% of the workshop have been facilitated by the national facilitators, and it is supported by the international faculty, where they just provide technical advice. 24 provincial facilitators or trainers have been developed as a result of this, of which 20% are from the animal health and 20% are from the environmental health. Out of these faculty that have been developed, 6 faculty were graduates of the training program, and 2 have been able to progress from the frontline level up to the intermediate level. I am an example of the common progression of this training program, where I started off at the One Health Frontline training program and then progressed onto the intermediate level. One of my intermediate project was a event-based surveillance, strengthening event-based surveillance, which has contributed to strengthening the national event-based surveillance at the national level, contributing to program sustainability and contribution to health systems strengthening. Next, please. So One Health Frontline FETP continues to contribute in building the capacity, especially One Health workforce capacity in country. The graduates consistently report high relevance and applicability to their work roles, and they have also developed a common language to communicate across the different sectors, especially when it comes to responding to One Health issues within the country. Moving on to institutionalization. Thank you. Moving on to institutionalization. Subnational faculty have been developed. Faculty have been developed at the provincial level as well as at the national level. A couple of One Health cohorts have allocated in their annual implementation budget to put in budget for running the training program in their provinces, and there are plans to roll out this training program in all 22 provinces going forward. Next, please. In terms of international measures, building subnational capacity and multi-sectoral coordination contributes to a more resilient systems capable of early detection, prevention, or rapid response and risk communication. Supporting this training program also supports the International Health Regulation 2025 in implementation and to improve the joint external evaluation indicators, particularly looking at workforce development, surveillance, zoonotic disease control, and emergency response. Next. Next, please. There are a few limitations, which includes early stage evaluation. Most of the findings were preliminary. There was selection bias involved, selection report of data, and limited line managers and senior manager interviews. Next, please. Moving on to recommendations. The first recommendation that stood out from this study was to strengthen representation of non-health sectors. And so this was taken into account, and in our recent implementation of the One Health Frontline FETP in one of the provinces in Papua New Guinea, we have implemented this recommendation where we trained 70% of the trainees from a non-health sector, and they were from the environment and wildlife conservation, including agriculture and livestock sectors, and 30% were from the human health sector. And lastly, recognizing One Health roles in job descriptions. Next, please. One Health Frontline FET-PNG is a proven model for building multi-sectoral field epidemiology capacity at the provincial level, and it strengthens IHR core capacities. The regional adaptation and rollout of OHF FET-PNG or the Frontline FET-PNG will accelerate progress towards a resilient, coordinated, and inclusive One Health systems, meaning the model that is used in Papua New Guinea can be used in other Pacific Island countries. However, it can be tailored to their context. Next, please. With that, it brings me to the end of my presentation. Thank you.
Thank you, Miriel. That was fantastic. And I think it's really nice to hear, particularly in a program that's drawing the links from right down to from the subnational level, right up also what does this mean for the IHRs? What does this mean for global health security? So thank you very much. And also wonderful to hear from someone who has been a part of the program and now in a position to reflect and share these sort of findings. We'll move on now to our third and last presentation before we go to the Q&A. I'm very pleased to introduce Dr. Raksmey, who is a research fellow at the Center for Natural Resources and Environment, the Cambodia Development Resource Institute, or CDRI. He earned his doctoral degree in engineering from the Tokyo Institute of Technology, Japan, specializing in global engineering for development, environment, and society. And his research primarily focuses on climate change and environment-related issues, including assessing the potential impacts of climate and land use changes on water resources, as well as drought assessment. His extensive experience in hydrological modeling and programming and working with large data sets, as well as collaborating with local and international NGOs, civil society organizations, and national and local authorities. So really a breadth of experience and knowledge. Prior to joining CDRI, he worked as a consultant contributing to the development of a master plan for the urban drainage system. Dr. Zhang, welcome.
Okay, thank you, Camilla, for the nice introduction. So again, good morning, everyone. My name is Raksmey, a research fellow from Cambodian Development Resource Institute. So as a Camilla introduction, so my expert is not in the WaSH sector rather than on water engineering, it's more on river basin management. So that there's a lot of things that I need to learn from the WaSH sectors, and I'm sure a lot of people here in the room, they are more expertise than me in the WaSH sectors. So again, today would like to share with all of you my small research, which is about the strengthening climate resilient water safety planning for inclusive WaSH service in Cambodia, or inclusive water sanitation and hygiene in Cambodia. So based on the Cambodian socio-economic surveys in 2023, next slide please, there's only 80% of the population of Cambodia have access to drinking water, but there are also inequalities between urban and rural, which we can see that in urban is around 93%, but on rural is only 85%. However, if you look at the sanitation service, there's only around 56 have access to safely managed service, and only 31% have basic sanitation service. And we also observe there's still practice of the open defecation, especially in rural areas around 9 to 10%, and urban is only 2.5%. Alarmingly, is around 15% of the rural population, it still rely on the surface water, which is not, untreated water source, which is harmful to the health. I'm sure you know all about the climate change impact. So the climate change impact, real impacts to the WaSH service. Although we mentioned 88% of the population of Cambodia have access to the drinking water, at least basic service. But if there's impacts of the climate change, the rate of service access will be dropped. So that might be only not 80%, 88%, but maybe drop to 80% during the drought or flood. And that limited access to service might be, was for the vulnerable group of people or marginalized group, for example, children, women, ethnicity minorities group who have limited access to the WaSH service, especially during the climate-related disaster impact. Next slide, please. So that's why in the mid of 2023, the government of Cambodia, through the two ministry, we call Ministry of Rural Development, MODIS, and Ministry of Industry, Science, Technology and Innovation, they released the guidelines called Climate Resilient Water Safety Planning for the water operator and local community to improve their service and planning for the better WaSH service at the local communities. So this guideline, they have 6 different steps. So step 1, they need to form a group they call Water Safety Planning Team. And the second one, they need to describe the water system at the local community or at the water supply station. And the third one, they need to identify the risk, including climate risk to the water system. Also identify the countermeasure in order to minimize the risk impact to the water system or water supply system, including climate risk. And the fourth step, they need to take action. So after they identify the countermeasure, so they take the action to put in the planning and implement it. And the fifth one, they need to, monitor and evaluate their plannings, because they propose the planning and they do the action. So then they monitor and evaluate. And the last one is to document it, lesson learned. What is the challenges, what's work and what's not working. So that's why the research objectives comes. We do not know this guideline whether to what extent it can support the climate resilient and inclusive WaSH service in Cambodia. So that's why we proposed this study to support the civil society, WaSH organization, and government actors in adapting and implementing these guidelines, and also to understand what could be the challenges and incentive in adapting and implementing these guidelines. Next slide, please. This study was conducted in 2 provinces in Cambodia, one in Boas and another one in Cambodia province, which is located close to the Tonle Sap Lake Basin, which you can see the middle part one. And these 2 provinces are vulnerable to the climate change, which could impact to the WaSH service or WaSH infrastructure also. Next slide, please. So that's why we proposed this study, and this study is come by the joint or collective effort from 5 different organizations from Cambodia and Australia. So first 2 is CDI, which is my organization, and the Institute for Sustainable Future at the University of Technology, Sydney, which is a research institute. And we have other 3 implementing partners. One we call East Midwest, which is a program of 3 networks. And another one is Water at Cambodia. And the last one is Cambodian Water Supply Association. And this study is supported by Australian government through the Water for Women Fund. Next slide, please. So this study is the participatory action research. So as I mentioned, we have implementing partners and we have research institute. So the implementing partner, they adapt the guidelines and use that guideline to train the local community and private water operator, which local communities include community council and also the member of the communities and village leader. And we are research institute. We also review the guidelines and we also observe the training conducted by the implementing partner. And we also do the interview with those who have been trained by our implementing partner. So that's why our data collection includes a key involvement interview with the WaSH actors, including NGO, WaSH association, and government actor at the sub-national level and national level. And we did a focus group discussion with the local communities, particularly the water safety planning team. That the guideline, we have 6 steps, right? The first step, they need to form the group. So the FGD, particularly, we did with that group of people who implementing the guideline and got training by our implementing partner. And again, we also reviewed the guideline by using the JETC consideration perspective to see whether the guideline, they include the JETC consideration in the guidelines or not. And last one is observational research, which we observe the training by the implementing partner, particularly on the risk management. Throughout the program implementation, so our implementing, next slide please. Our implementing partner, they trained in total WaSH actors in total 171 people in 2 sides of the project's implementation. So WaSH actor include the district official, commune council, commune committee for women and children, village leader and private water operators, and so on. And the representative from the vulnerable group in the local communities also. Next slide, please. This is some of the photos captured during the capacity building training. This is for non-PI water supplies communes. Next slide, please. And this is for the PI water supplies commune. So as I mentioned, once implementing partner, they focus more on, and they focus on non-PI water supply communities. And another implementing partner, they focus on the private water operator, which is PI water supplies communities. Next slide, please. So throughout the program development, we also see the expand of the WaSH service at the local community. For example, our implementing partner, they provided the water filter with the 20-liter water storage, particularly to the low-income household or women-headed household. And also they also installed the toilets or latrine for the poor household also. And also install the fence to protect the well or the water source. Next slide, please. For our research data collection, so we collected data, as I mentioned, KI and FGD at both national level and sub-national levels. In total, we collected data from 55 people, including government officer, NGO, WaSH association. Next slide, please. This is some of the photo captured during our data collection. For example, the photo on the left-hand side, we did the FGD with the communes councillor, village leader, and water operator. And the right-hand side, the bottom one, we did the KI with the government actors in Boas province. Next slide, please. So we move to result and discussion. We observe the positive outcome from the project's implementation, especially the access to the clean water by providing the water filter and water storage, and also before that, low-income household or people in the local community, they need to buy the bottled water for their drinking water. So that's why they need to spend some money on that. But during this program implementation, our implementing partner, they provided the water filters, so that low-income household, they do not need to spend money on bottled water. And they also provide in the subsidy form in latrine and toilet to the poor household also. Next slide, please. Although there are some challenges in implementing this guidelines or program. For example, we observe there's still low communities engagement or participation during the program due to the lack of the knowledge gap in some people, there's still low awareness the relationship between climate change impact on the WaSH service. And another thing is limited local climate information and data. As I mentioned in the guideline, the 6 step, on the 3rd step, they need to do risk assessment. And one is that it include climate risk assessment. Without climate data at the local level, local community, they cannot do comprehensively conduct risk assessment. So during this program, they use their experience, or we call indigenous knowledge. For example, the elderly people, they use their memory and experience for the last 10 years, which location that impacts by floods or by drought. So they use this knowledge to mapping the location or the pattern or the climate risk at the local communities. And another one is the mobility or logistical challenge, because the training was conducted at the communes hall. So people from the household, which, for example, particularly for the elderly people or people with disability, it is challenging to move from their homes to the commune hall to do to receive the training. And there should be some financial support for them also to join the training. So that's why, in order to enhance the climate resilient water supply planning implementation, there should be, long-term capacity building training, especially for the water safety planning team that have been set up at the local community. So there should be ongoing, more training to build the capacity. So that's why they can do the risk assessment, including climate risk assessment at the local community. And they can also develop the action plan for their own communes. And next one is we need some financial support for especially for the vulnerable group from the poor household, which we encourage them to expand access to WaSH service, but they also need to spend money, and they also need to spend their money for other need for foods also. So some subsidy form or some financial support for them to get the access to WaSH service or drinking water or toilets or latrine, that should be in consider. Next slide, please. And in order to make the climate resilient water safety planning team planning, development, and implementation more inclusively, we observe that there should be the representation of the vulnerable group in the water safety planning team to have their voice to be heard, and to make sure that the WaSH facility and infrastructure consider the JETC consideration or component when they construct or they do or they install the WaSH facilities. Another one is women participation is very important, because women at the home, they are the one who manage the water. So their insights, their perception is very important for the effectiveness of project's implementation. Next slide, please. As I mentioned, we also did review the guideline. We would like to see how this guideline integrate the JETC consideration throughout their guideline. And again, as I mentioned earlier, there's two guidelines from different Ministry of Rural Development, which focus more on rural community or non-pipe water supply community. And another one is Ministry of Industry, Science, Technology and Innovation, which their guideline focus more on private water operator or pipe water supply. So we review the guideline from Ministry of Rural Development. The guideline emphasize the inclusive participation of the local community, or they emphasize the gender balance in the water safety planning team. Although there's still entry points or opportunity to include or to consider the JETC component of perspective in other steps. It's not only the first step they need to form the water safety planning team, but in other steps of, for example, climate risk assessment, there's still lack of the comprehensive integration of JETC. While the guideline from the Ministry of Industry, Science and Technology still lacks of the JETC consideration because they focus only the private water operator. Next slide, please. So throughout the analysis, we recommend some points to make to ensure that there's increase of adaptation of this guideline. For example, to promote the inclusive community engagement, the practitioner or the government or local community need to adapt this guideline to the local context, especially where the resource and awareness is limited, by ensure that the representative from the vulnerable group need to be sit in the water safety planning team, and some financial support need to be there also. And the second one is enhanced capacity building training. So again, training capacity activity need to be there. It's not only one time and then finish. That should be more training called refresher training. And also there should be training should be not only at the commune hall, but there should be some other approach to visit their home, something like that. Another one is to provide the target financial support. If we want to secure the long-term funding support the WaSH activity, we recommend that the WaSH planning should include in the commune development plan. In Cambodia, at the commune, they have commune development plan and commune investment plan, which they can secure the money from the national level. So if the commune, they include the WaSH planning in the commune development plan, so certain amount of money can secure in that. Usually at the commune level, they focus more on the connectivity development program, for example, road infrastructure, irrigation. I don't mean that those programs that not good, but I mean in order to increase the WaSH service, there should be WaSH planning included in the community development plan also. The last one is strengthening data and collaboration. So again, climate data is very important for the climate risk assessment. So there should be more climate data available by collaboration between different community ministry, because Ministry of Rural Development and Ministry of Industry, Science, Technology and Innovation, they are not the one who monitor climate data. There is another ministry. So the collaboration between this among these three can increase the local climate data also. And the last one is there should be some M&A framework. We have the guidelines, we roll out and we implement, but we need some monitoring and evaluation framework to document it, whether this guideline is can be used, can be adapted, what is the challenge, something like that. And also we can showcase the successful story. For example, if this commune, they implement this guideline successfully, they also can showcase to the other community to increase the adoption of this guideline also. So in the conclusion, this guideline is one of the good steps that Cambodia released these guidelines, although its full effectiveness is not understood yet or not realized yet. And there are also several challenges during the implementation, including low community engagement, financial support, and technical knowledge. So that's why to address this, there should be more financial support, capacity building training, and gender-sensitive approach to break the accessibility and equity gaps. And last but not least is the M&E framework or tool to monitor and evaluate the performance of this guideline. So that's the end of my presentation. Next slide, please. We also publish our research into the policy, please. You may scan this to see that. Thank you.
Thank you very much, Raksmey. That's fantastic, and just a lot of wealth. And I can recommend the policy brief. I had a look at it yesterday and goes into more detail. It's a great read. So we now have about 20 minutes, 25 minutes. We'll try and finish up a few minutes before 10, time to move around and grab a cup of coffee if you need, for some Q&A. Thank you to all the speakers for keeping good times. It's allowed us a lot of time for discussion, which I think is the most valuable part of these kinds of sessions and conferences. Does anyone have a burning question right away? Wait, just hold, and if you just hold for a mic to come to you, so that everyone can hear, including on Miriel online. So I think there was one question here first, and then here. If you don't mind just introducing yourself before you ask your question. Thanks.
Okay, good morning. Chantalang Sisuan from Laos. Cambodia is our neighbor, and I have a question because I work on a WaSH sector as well, and we are now under the development of the community WaSH resilience guidelines. It's good to hear from the Cambodia that you already have one in place, but I just curious on the what your recommendation on the climate data that we need to have in place, and also I just want maybe you can elaborate more what type of climate data that's suitable in terms of the WaSH, and also in any in your research or you have the consultation with communities and governments, but the recommendation or some suggestion for Laos or for me in terms of guideline development, what should I consider to make it successful in terms of the development and implementation? Thank you.
So thank you, our colleagues from Laos. Yeah, actually, during this year, we also connect with colleagues from UNICEF Laos to discuss about this thing also, because we wrote one concept note to apply to some grant. And they also mentioned that there's currently there's development of this kind of guidelines. Also, thank you for that. Regarding the climate data, so for the climate risk assessment at the local community, we found two important climate data. Is one is the flooding. How to say? The data that showing how the special flooding mapping or something like that to know what is which part that, for example, at one commune, which part that impacts by the flooding, and if the water supply system is in that location, commune need to take action for that, and drought also. For the pie water supply community, might not be so serious compared to the non-pie water supply, because non-pie water supply they more relies on surface water and groundwater. Surface water is from the river or stream and the pond, and the groundwater is on the well, the main dig well. So that drought information. The both time series in different time scale, yearly, monthly drought data is also important for the water safety planning team to conduct this kind of climate risk. I think this two, because in Cambodia, these two of the climate related disaster is very serious in Cambodia's flood and drought. So that's why I say this two type of data is very important, and I also think that in Laos we have similar kinds of climate-related disaster happen in not only Laos, Cambodia, but in the lower Mekong area. And another one is the recommendation. Actually, we present the recommendation here also. So I think one of the main point is the participation or engagement from the local community. And I think this is not only WaSH program, it's also other program also face similar kinds of challenging when we try to implement this kind of program at the local community. It's challenging to engage people from the local community because they have their own competing commitment, right? So they need to work to earn money. Especially when we talk about WaSH, we present that 88% of the population have access to drinking water. Around 20% of the people who have less access to the water service is the people from the low-income household. So when we say low-income household, so they need to spend their time to earn money. So, but when we implement the program, we need them to join, right? But they have their own competing commitment. So that's why some financial support need to provide to them to engage them in the community. Although it might be sustainable to do that, but at least we can engage them to do the training, to do the camping, awareness raising campaign, something like that. I hope I could respond to some of the curiosity. Thank you.
Hi, I'm Puri. I'm from Cambodia as well. I have one question for Sarah and also one for Dr. Raksmey. So Sarah, you mentioned a franchise partner in the Oki app. Would you mind elaborate a little bit more? What do you mean by that? And let's say if Cambodia would like to take up this kind of Oki in our country, what would be the challenges or lesson learned that Cambodia need to take into consideration for taking up this kind of app, and any chance of localization, because English is not our first language in the country. So is there any possibility of integrating Khmer language into that app? That's the question for Sarah. And for Dr. Raksmey, you mentioned you also access this kind of guideline using JETC principle. So I'm wondering, like, how many participants are females and how many participants having disabilities or coming from indigenous people in your sample, if there are any, and if there is any different impression across this stakeholder from your findings? Because so far I only see like the overall findings, but is there any point that this kind of finding coming or emerging from women's or the people with disability, or they are all having the same conclusion from your finding? And yep, I think that should be it for now.
I can go first. Thank you for your question. Yes, so the way that the social franchise partners work, so the app is supported by UNICEF Global, and then to deploy and localize the app in each country, there is an agreement with a franchise partner. So, for example, for Papua New Guinea, this is Save the Children is the franchise partner, and they're responsible for managing the app in that country. They establish partnerships with tech vendors to manage the back end of the app, and they're also responsible for promoting the app, and they're really on the ground implementing the app. To become a social franchise partner, the rough, very rough cost, because it definitely depends on context, but it's about $250,000 USD. But obviously that can be a lot higher in more challenging context. Some of the challenges that we've heard from franchise partners has been contracting the tech vendors, and the high costs of the rollout. And so for example, for Save the Children, their tech vendor is based in Australia, just because of the availability in Papua New Guinea. And in terms of the languages, so yes, it's completely localized. There can be multiple languages in the app. Yes, it's not in English either. Yeah. In schools, so government, so in the Philippines, the government of the Ministry of Education and Ministry of Health have supported the app, and that is through schools and then also alternative learning systems, so that girls can access it if they're not in the formal school system. And in Indonesia, the government is also supporting that through the Islamic Healthy School Initiative. So that's an exciting move for OCI, and we hope to do more integration into the school curriculum moving forward. But it's a very slow process. Both for OCI, for PNG, Indonesia and the Philippines, they have been supported since 2021 through DFAT's funding support. And that was deployed in 2021, and then that project ended in 2024. So they've had quite a lot of time to integrate OCI into the school curricula, and now it's been supported through UNICEF Australia. The other countries are more recent than that, so it will take time for government take up.
Thank you, Bori, for the question. So there's two questions. One is JETSI review. So actually the JETSI review of the guidelines is, done it by our implementing partner, WaSH Cambodia. They use some of the JETSI framework to conduct the review on this. Although I do not, because there are a lot of findings from that. I just put summary of the finding to show that this guideline still lack of the JETSI consideration in the guidelines. So again, in the review, they do not conduct, kind of consultative workshop with the JETSI group. They just use the JETSI framework and did the review on the guidelines directly. And for some outstanding result or conclusion from the JETC perspective. Actually, we have different tool of research output or analysis. This one is the overall, but our research partner, they did another one is for the JETC specifically. So that's why I do not disaggregate the data or the analysis into JETC component and the overall one. But at least the findings from here, we also interview, we call WaSH, women WaSH leader at the local or commune council member. We also do interview with, although we do not, again, disaggregate the data, but indeed we did the interview with them to see the perspective of the women leader in WaSH sectors. So one of the findings that I mentioned, they mentioned that women participation is important because women is the one who manage the water at their home, at the local community. So include women participation, not just women participation, but meaningfully heard their idea and their voice, especially during the decision-making process. So that result is come from specifically from women leader in WaSH sector. Yeah, thank you.
Thank you. We've got more questions in the room, I think up here, and then Ian. And I have a question for Miriel. If one of those questions doesn't go to Miriel yet, well, sorry, just up the back over here. But we'll come to these questions first.
Hi, my name is Letitia. I'm from Development Intelligence Lab. My question is for Sarah. You just mentioned increasing male involvement of peers and family members, and I was just wondering what this would look like and what considerations you are balancing. And then as a second part, I was also wondering if OKI is exploring partnerships with local suppliers to the schools of sanitary products.
Thanks, Letitia. Yeah, I got that right. So we are exploring boys and male influence and integration into OKI. It's as I said, it's started off as the male radio hosts in Papua New Guinea, and then also involving male teachers through the school promotion. I think what would be really important is how to engage the male community leaders so that you have that really enabling and supportive environment. I think, and while that and because it also helps with, especially with young boys, engaging them early about menstruation and how normal it is will help with bullying as well, because that's one of the things that girls have reported at school is that they get bullied for having their periods. So really integrating that into the school curriculum would be very important to normalise. I think a key consideration for the OKI app is that while that is really important, it's also important that this girls remain at the centre of the app because it is about gender equality and supporting the girls. And so it's, as I said, it's important to have that enabling environment, but to keep prioritising girls through this app. And your question about supplies, so that did come up as an unresolved challenge, sanitary products and menstruation supplies. OKI isn't doing anything in that area at the moment, but they do have a lot of great partners through the private sector and then also civil society organisations. So it's something that they could leverage those partnerships and explore further, because I know it's a gap. And And if you're in communities where girls are using reusable sanitary pads, but then they have to wash them and hang them outside, and that's seen as taboo, then that's a really big challenge that, still needs to be resolved. So, in terms of OCI's role in that, it's probably connecting to the right partners and how to resolve.
Thanks. Ian, I think you had a question. Oh, here's the mic coming here.
Thank you. My name's Ian Anderson. I'm a health economist. So I'd like to make some comments or questions to Miriel. I thought your presentation was very interesting. I thought you showed that there was very strategic data that you were collecting, that you did it in a very systematic way, you're tracking. I mean, it was a really convincing story. The part that worried me was your heading on the word barriers, and they had the phrase underuse by management. This really is, to me, sort of quite a serious and strategic issue, because if you're collecting all this data and generating it, and it's all so strategic, then what happens to it? And I don't think you're alone on this. I did a couple of evaluations in Papua New Guinea myself, and I asked about 20 different people, both Australian consultants and PNG officials, can you give me one example where you've used evidence or the monitoring and evaluation system to change program and improve quality? And not one single person could give me an example. I mean, I found that really quite a worrying issue. And I suggested at one stage that if you institutionalised the use of monitoring and evaluation and data to improve performance, then perhaps through the aid program, you could consider a performance bonus. And I was told by several people, gee, if you did that, we'd have to change everything. So there really does seem to be this sort of almost this cultural problem about management don't use the data that you are generating so well. So do you have a thought or an observation about why they don't use just use the data that you're so good at generating? And my second comment is, the data collection you're doing is so systematic and so useful. I wonder if it's possible to expand it to include the costs of doing nothing. In other words, what are these diseases causing in terms of cost directly and indirectly to households, individuals, loss of labour, et cetera, because that could add to the advocacy as to why investment is useful. But I think you're doing a great job, so that's it.
Thanks, Ian, for the questions. So with regards to using data, I think I acknowledge and I agree with what you're saying. Most times data is not used, fully utilized, especially at the management level when it's reported from the bottom line upwards. However, as a result of this training program, most of the data that is collected is fed into the management, and then it is utilized. A classic example would be utilizing the One Health Frontline WhatsApp groups, where they collect information about One Health alerts, and then it is reported to the Provincial Disease Control Office, and then it is further reported up to the national level, where it is recorded into the event-based surveillance, and actions are taken to prevent any further disease outbreaks that might affect the community and their day-to-day livelihoods. So that's number one. Although it is a challenge of utilizing data, it's slowly improving. With regards to the second question, please, if you can rephrase it again.
Yes, thank you. You've got people doing systematic surveys regularly, and that's a very sort of useful thing to collect data, and you're collecting data on epidemiology, so I understand that as well. But what I have often noticed when countries or development partners are trying to work out where we're going to set the priorities, they don't have very much data on the actual costs of the diseases. So, for example, you might be able to say there's a very good study done in Solomon Islands. Most of the costs of dealing with non-communicable diseases, especially diabetes, occur at a tertiary hospital in Honiara at a very expensive level. So it's not necessarily effective, but it's certainly expensive, and it's inequitable because people have to travel into Honiara to get treatment for diabetes. And it could have been treated at a primary health care level at a much lower cost, more effectively, more efficiently, and more equitably. So the collection of data on costs, who's bearing the costs and what are the costs, very useful for triaging the allocation of resources, health system strengthening, etc. So I just wonder if it's possible to start collecting data. Maybe it's just too difficult, but I mean, it's just a possible opportunity to collect data. Thank you.
Thanks, Ian. I definitely agree with what you're saying. At the moment, to address that, there are some comprehensive M&E plan that's currently being underway to at least contribute to addressing that big issue. And at the national level, the burden of disease and costs are probably below this frontline level program. So that's all I can say. Thank you.
Thanks, Miriel. We're just at about 4 minutes to 10, so I think we'll wrap it up there. I'm sure our speakers would be happy to carry on conversations in the break. Would you please join me again in thanking all the speakers and their collaborators? And also to thank our team from the IT and the mic running and the timekeeping side. It's a really important part of keeping the conference going, so thank you as well. Thanks, everybody. Enjoy the rest of your day.